Welcome back to Weekend Dawn on Channel 405. My name is Jacob Moshokoa. Flying solo today, missing Liesl Wilson, but she'll be with us again next weekend. We're having fun on the show. Just had a really good discussion with a musician that I think is probably becoming one of my most favorite musicians. I can't wait to see him perform a little later. That is Manu Worldstar. And you heard his song when we signed out a little later. It's one of my favorites on my playlist. It's called Nalingi. But we're changing things up now. It's time for Newsweek Part 2. And we'll be chatting about Movember. Movember is an annual event involving the growing of moustaches during the month of November to raise awareness about men's health issues such as anxiety, prostate cancer, testicular cancer, and men's suicide. When it comes to their health, too many men, us, we don't talk. We barely even take action, and sometimes even die too young. So we're joined in studio today by Dr. Yusuf Mayet. He joins us to chat about prostate cancer and how it affects men. Doctor, welcome.
Thank you, Jacob.
Thank you so much for having me, or for being here. I want to ask you about prostate cancer. What is prostate cancer?
So, I mean, the prostate gland is a little walnut-sized gland that sits below the bladder, all right? And essentially, its function is to secrete a seminal fluid, that nourishes your sperm. And the gland's only found in men. And obviously, if you get abnormal growth or proliferation of cells, you develop prostate cancer. It's quite a common sort of disease. The most common cancer diagnosed in South Africa in males. Okay. Prostate. Second most common diagnosed in males worldwide after lung cancer.
Wow.
And also mortality is also in males the second most after lung cancer. So it's quite a significant cancer that we're dealing with here.
Doc, but how do I go about identifying it? Like, how do I make sure that I don't have it? And how often do I need to check?
So look, there's certain risk factors, all right? Generally, in the average male, above the age of 50, you're obviously at risk. People of African ancestry have been shown to be at a higher risk, okay? More aggressive forms, obviously, all right? Certain lifestyle, dietary factors as well. And a family history. If you have first-degree relatives who've been diagnosed, you obviously may be put at risk, all right? The problem is, early prostate cancer generally patients have no symptoms. So therefore, screening comes to the fore, and that's where screening becomes quite important. So according to guidelines, in an average male, if you're above the age of 50, you should be getting screened, okay? Either doing a blood test or a prostate-specific antigen blood test with your general practitioner. And obviously the dreaded digital rectal examination of the prostate, which is keeping men away, I can tell you that. If you are at a higher risk, probably age of 40 to 45 is when you should be going through and getting yourself checked out, yeah?
Have you heard of any cases that happen with people younger than 50 years old or 40 years old?
Look, there's no general rule in medicine, but yes, it's very uncommon, below the age of 40.
Okay.
But anything's possible in medicine, yeah?
Oh, I see. Dr. Yusuf, come on, man. No, but really, in terms of treating it then, is it an expensive thing?
So look, treatment, I would say a strategy should be, put forward in what we call a multidisciplinary team.
Okay.
Your urologist, your medical oncologist, radiation oncologist, etc. And it's based on the severity of the disease, all right? It's based on your life expectancy. It's based on your values and the patient's preferences as well, all right? There's different treatments for localized disease and there's different treatments for advanced disease. And yes, these can be very expensive. So, if you have a good medical aid, you may be, having access to some of these. The problem is a lot of our patients in the state sector, who don't have access to these. And I think that's where the problem is. So, the key then is to get screened early detection of the disease. Why? You get effective treatment up front and better outcomes, all right? You pick it up late, the outcomes are worse off, and the treatment becomes more expensive as well.
And then in terms of the stigmas surrounding cancer, prostate cancer specifically, what are the stigmas out there?
Well, I think it's similar for men with regards to prostate and testicular cancer. You know? I think culturally in our communities, as a male, you want to be in power, you know, of yourself. I think it's a problem of loss of masculinity more than anything else. And it's related to multiple factors. So, you know, if you have testicular cancer or prostate cancer, those are your, you know, manly parts. And you don't want it to look diseased to the community, number one. Number two, the examination. As we said, a digital rectal examination. I mean, if I mention that, people are running out the door.
They're gone.
You know what I'm saying? And lastly, I think it's obviously secondary to after effects and side effects of the treatment once you're diagnosed. Because you do get loss of masculinity, you know, gynecomastia, which is increase in breast mass, decreased libido, erectile dysfunction, you know. The last thing I think is maybe our fault as medical practitioners is the terminology used. So castration.
Oh, goodness.
You know, if you think of surgical castration or medical castration, just the word castration puts you off, doesn't it?
I'm thinking it's gone.
You know, so that's also you running out the door.
Yeah.
So I think there's a big stigma, all right? But I think, you know, to put forward is the earlier it's detected, the better your chances of survival, rather than later detected, definitely.
But then what do we as men need to do to empower other men to not be scared about going to do checkups, etc., and to make them aware as well? Because I feel as though I'm a young male in my 30s.
Yes.
I know that there's things like prostate cancer and testicular cancer out there.
Yeah.
But today I am now enlightened for the first time.
Sure.
What should we be doing? What's our role as men who are in the know?
These sort of initiatives like Movember, there's obviously other initiatives, you know, where I think they sort of just create awareness, you know. They grow a moustache that looks, you know, sort of odd. Somebody's going to ask you, why are you growing a moustache? And you're going to tell them, listen, I'm creating awareness for prostate cancer, for men's health on the whole. And if this sort of infiltrates and goes about, and we have sort of, you know, talk about this quite often, you know, you get less of a stigma. You know, you look at it more of a disease that needs to be sorted out, less than, this guy is less manly, you know. It's a very difficult process. It's a very difficult process. I think our bigger issue also is, you know, if we're looking at people who don't have access to these things.
There we go, yeah.
So people out there in the rural areas, you know, you see them presenting quite late because they just don't have access. And we need to maybe find ways of creating access for them. And I think that's obviously the way forward in looking forward. So funding, you know, is part of awareness and helping these people get access. Definitely.
So there's still a long way to go in terms of getting the word out there.
There's definitely a long way to go.
And now, tell me about yourself, your day-to-day activities. Do you deal with a lot of clients who are suffering from prostate cancer?
I do. I know. Myself, I treat a lot of different, you know, cancers, hematological solid tumors. We do see patients with a lot of prostate cancer. You know, the ones with localized cancers are more so treated by the urologists and the radiation oncologists. Myself, as a medical oncologist, I see them more so when they're more advanced. Oh. So it's sad, you know, but we do our best.
You do your best. And then, and I want to actually just delve a little more into that. When you have to deal with people who are in an advanced stage, how do you keep a level head for yourself and also at the same time keep their, I don't know, their emotional state also like above, just to make them feel okay? How do you do that?
So I think the one thing I've learned is it's never easy for the patient, including myself. Number two, I've learned you need to be as honest as possible. Don't sort of promise things that's not going to happen. Right? And you got to involve patients in their own treatment plans because they have different values, they have different preferences, you know. You got to be sensitive, you got to be empathetic, and if you have those values, it becomes a little bit easier, if it's easy at all. I mean, sometimes I think to myself, what am I doing? But there's obvious success stories sometimes, and that keeps you going, knowing that you've sort of made a change in someone's life, knowing that you've probably created more functionality for this person, and created a bit of better quality of life for him. And that's the aim, especially in the advanced stage, yeah.
Wow, Dr. Yusuf Mayet, thank you so much for joining us. Where do we find you? Social media? Where's your practice? Do you have your practice?
So I'm practicing at Santon Oncology in Morningside, and I'm also at Mill Park Hospital in Parktown.
All right. Thank you so much for joining us. Really appreciate it.
Thank you so much, Jacob.
All the best.
Cheers.
Cool stuff. So prostate cancer, like he said, is a cancer that occurs in the prostate. During the month of Movember, issues related to men, including prostate cancer, will be highlighted. A big thank you to Dr. Yusuf Mayet for joining us and changing the way men's health is perceived.